Representative Kahn. How are you doing today?
Good. Andrew, how are you?
I'm doing well. So the last time we saw you, it was American Nurse Heroes. You were driving around giving vaccines mobily to people across the Philadelphia area. Obviously, a lot has changed. Can you get us up to speed about what's been going on in your life?
Sure. Yeah, so, really because of the program, I realized that we really needed a healthcare champion in the legislature, someone who had a healthcare background, someone that was going to be pushing for reforms to make our public health infrastructure stronger. And so I realized that we needed more elected officials that had that background and would be those champions. So I decided to run for office, and I've won. So I'm now state representative here for the 194th district, which is Northwest Philadelphia. It's Roxborough, it's Manayunk, East Falls, and most of Chestnut Hill.
Well, first of all, congratulations
Thank
on
you.
your win. What I do want to know is what was it like transitioning from nurse to state representative, going through campaigns, those 2 years from, when we last saw you until now? Can you just give us a little overview about what's been going on and what the transition has been like?
Yeah, it was a busy 2 years because I started running for office while I was doing the vaccination program, while I was finishing my PhD, while I was working. So I had to really balance a lot. And I think as nurses, we're used to balancing multiple things. We multitask as nurses, so it was difficult. But the transition's been phenomenal. I've been in this role since December, and I think it really is allowing me to advocate for the welfare of my patients beyond the bedside. And it's when we swore the Nightingale Pledge to say that we would work to support the welfare of our patients, we didn't say at the bedside, we just said the welfare of our patients. And so I'm able to push for systemic reform, and me and my colleagues are pushing for deep systemic reform to make things better for patients, to make staffing safer for nurses and patients, to make hospitals less likely to go under. I think a lot of us are losing our community hospitals. We're seeing a lot of for-profit corporations buying hospitals and sort of not managing the way that our community feels like we need to. And we also see a lot of our social safety net, where our people that are struggling to make it are kind of falling through the cracks, and really supporting our safety net to make sure that people are not falling behind. As a nurse, I'm able to advocate for that. As a nurse, I'm able to advocate for changes in the legislature by creating bills, working with other legislators to get their bills passed, and working to be a force in our community to advocate for what we need.
Wow, it sounds like you're doing a lot of busy work there.
Yep, I usually work 12, 14, 16-hour days.
Wow, that's impressive. We really do appreciate and thank the work and the effort that you do put into this job. Now, I do have a couple questions on the legislative side. You said that you're working through and pushing bills through to help nurses. What are some of the specific things that you're doing right now to help these nurses? What sort of bills are you pushing through, and the laws that you're going to be enacting to make life easier for nurses?
So when I worked as a nurse, the number one complaint was unsafe staffing. And sometimes as a nurse, I felt like I needed two of me to get my job completed. And the immense stress that nurses are feeling, we're seeing in that people are leaving their employers. And nurses you can pay them as much as you want, but nurses are not going to work long-term in an environment where they don't feel like they're able to provide safe care. And so I worked as the president of the Pennsylvania State Nurses Association, and as a legislator, I worked on the Patient Safety Act. And basically that would set minimum staffing standards at hospitals. So it would allow nurses to work in safe environments where they're not overburdened, so that there's standards. Because as I said in our health committee meeting, right now it's like the wild, wild west for staffing for nurses. They could go to a shift and have 5, 6, 7, 8 patients, and it's illegal. And we know it's not safe. And the literature, the research shows us that it's not safe. Nurses get burned out, patients get hurt, and unfortunately patients die. And what it's all about is about safety. It's keeping our patients safe. It's keeping nurses safe. It's making sure we're investing in our nursing workforce and making nurses feel supported. And I think during the pandemic, as we saw, nurses are truly heroes. And during the pandemic, the whole nation got to see it in real time. They got to see how nurses were going above and beyond consistently. And it wasn't individual nurses that were being spotlighted. It was nurses that were working, putting their lives at risk, putting their families' lives at risk, that showed up for work, willing to do whatever to carry this trauma. And they were doing it from day one of the pandemic. Before we even know how bad COVID was, if you got it, they were putting their lives at risk. And they did it. And nurses are truly heroic. And we have a huge debt to pay to nurses. Coming out of the pandemic, we're realizing that we have got to support our nurses, because nurses are going to leave. They can only do so much. As legislators, we have to do everything we can to make sure that those words that they said, that you're heroes and we got your back, mean something. Nurses are asking for one thing. One thing you ask nurses: safe staffing. That's a bill that we're fighting for, that I will fight for every day and on the weekends. And it's something that I'm the first co-sponsor of the bill it's a bipartisan bill by 2 Republicans and a Democrat. I'm the first co-sponsor on that bill, and I've been working very hard to get my colleagues on board. I sit in the Health Committee where that bill is right now, and we hope to move that bill very soon.
Well, it sounds like what you're doing is fantastic and going to help nurses a lot. I want to pivot a little bit away from now and go back towards the pandemic, because, we as humans love to just go back, hindsight's 2020 sort of thing, and look back and critique ourselves because of it. Was there any moment when you were looking back in your time during the pandemic where you're like, I learned something from this? Or was it more of this is all in the moment, it's going to be retained later? Or did you really know that, what you were doing was something to learn from?
During the pandemic, there was a point when it was after I started the vaccine program that I had worked a long shift as a nurse. I volunteered for 4.5, 5 hours after work giving COVID vaccinations. And I was home, it was about 11:15 at night, and I'm texting council members about a decision by our health department that I thought was making it harder for people to get these vaccinations. And I realized that this is not normal. To work a full day, volunteer to help for a program that should have been managed by government, and then to have to lobby our elected officials because of the failures of government for something that was a different issue. And I realized that this isn't okay. And that was, I think, one of the reasons when I decided that it was time for me to run for office. And I think for us, sometimes we feel like we're banging our heads against the wall, and we feel like we can offer more, and we can fill a role that currently isn't being filled. When I ran for office and I won, I became the first advanced practice nurse ever elected to the legislature in Pennsylvania. And one of the few legislators that have a PhD, actually, during the program, the COVID vaccine program, and shortly after I finished my PhD. And so bringing that research knowledge to the legislator, so we're enacting evidence-based research and putting that into policy, making it policy. That was something that I was uniquely trained to do, and I realized that I could continue to do what I was doing, and that would be fine, but I felt like I could offer more, and that I had to step outside of that comfort zone and do something I had never done, which was running for office. And in running for office is including raising a lot of money, and that's me on the phone for hours, calling people, strangers, family members, asking them for money, which I am not comfortable doing, but it was something that it was the only way I could get elected is if because I was running up against an incumbent who had been in office for I think they were on their 6th term, and so I had to do something that would make me uncomfortable, but I thought it was important, and I knew I had to step outside of my comfort zone to do it.
Well, that's a fantastic answer to that, and I appreciate that. Pivoting back towards the now, the Biden administration, WHO declared the pandemic over. Obviously, throughout history, we've had a lot of pandemics, so this isn't going to be the last one. What do you think we learned from this one that we can enact in the next pandemic to help save more lives and keep more people safe?
I would say the first change I would like to see is to have nurses in positions of leadership helping to manage the pandemic. I firmly believe that if we had nurses at the table making policy, helping to really formulate our strategy, we would not have had as many deaths as we did. We wouldn't have had as much disparity as we did in terms of who got access to COVID testing, who got access to the vaccination, who lived, who died. I think if we had nurses at the table making policy, things would have been different. So my first hope is that moving forward, we're going to have more nurses stepping up, running for positions, running for board of directors, running for office, that are going to be promoted and that are going to be trying to get those CEO positions at hospitals, trying to get those high positions at the Department of Health for their city, their municipality, for their state, and even in the federal government. We need nurses leading the way. We saw what could happen when we let nurses do their thing. We had nurses doing incredibly innovative things, highlighted some on your program, and we've seen countless cases where nurses were stepping up because nurses spend the most time at the table. Nurses spend the most time at the bedside with the patient, more than any other provider, more than anyone else, sometimes even more than the families. Nurses know what's wrong with their healthcare system. Nurses know how to fix it. And if we give the nurses the opportunities to be in leadership, they're going to show how much they can do. And that was a real failure, I think, was the fact that we just didn't have those nurses that were given those opportunities. And so I hope to be part of that change, be a nurse being a nurse that is in that leadership position in the House of Representatives in Pennsylvania. The other thing I would say is that we have to make sure that those that are marginalized don't get left behind again. We saw during the pandemic people with disabilities, people with accessibility issues, people with language barriers, people that were low socioeconomic categories, people of color were left behind. We saw those disparities in terms of who was able to get COVID testing, who was able to get the vaccination. And we also saw, because of those health disparities, we were able to see that when people got COVID, they were more likely to get sick and die if they were people of color, if they were low socioeconomic status. We have to make sure that these groups we are prioritizing so that we can reduce the health disparities in these groups. And so my hope is that if we have another pandemic, that these groups are prioritized, not as an afterthought. It shouldn't have been. I was very proud to do the program that I created with Anna Pern. We were very proud to do it and very happy to be in the community doing this work. But really, this is work that should have been done. It should have been thought of by our government, and it should have been enacted as a sustainable program. And currently, it remains to be seen if we go into another pandemic whether or not these groups will be prioritized. I'll be advocating for it. I know many other people will be, but we can't leave people with health disparities. We can't leave people who have been marginalized behind again in the next pandemic.
Well, that's fantastic, and those are great answers to that question. We're going to pivot a little bit more, one more time, away from nursing, policy, all that. And we're gonna pivot to questions about you. The first question that I want to ask about you is if you could go back to, say, May of 2020 when the pandemic was at its height, we were doing the whole lockdown thing. If you could travel back there and tell your past self, hey, pandemic's going to be over. I'm also going to be a state legislator. Would you have believed yourself? Like if you were to tell yourself back in 2020, hey, this is what I'm doing now, would you have believed yourself?
So if I were to look back and if I were to talk to myself then, I don't know that I would let myself know, how much work would have been involved and how difficult things would have been. I think there were amazing things that happened. Now, when I was elected to office, and I'm in a role that I love, and I love the work that I'm doing in the community. But some of our greatest fears were realized. We knew that the fact that people were being isolated that it would have a tremendous mental health consequence, and we see it has. Unfortunately, we see the rates of depression and anxiety. We see the students that really lost so much by not being in school and having virtual learning, and how ineffective it was. I think we did the best that we could, and I don't know what I would tell myself, because I think it was that sense of urgency of really not knowing what would happen that really drove me to have those long days where I was driving every single day in the spring of 2021. I was either giving COVID shots, I was documenting, I was working on this volunteer vaccination program. I think if I didn't have that threat that something really bad could happen if I wasn't doing it, I don't know that I would have been as driven. So I don't know that I would change anything, actually.
Well, I'm glad you wouldn't change anything. And, opposite side of the spectrum now, instead of the past, let's go to the future. What's next for you? What's next for Representative Kahn? What are you planning to do with your future?
I want to be someone that is remembered as someone who just worked incredibly hard for his community, someone that the people in the community were incredibly proud of, and they would say, this is who we need to represent. We need someone to represent us that's like this. Someone that's going to hustle, someone that's going to work, someone that's going to wake up every day and just have one thing on mind: making things better for the people who live in the community. That's what I wanted to do when I ran. That's the work that I feel like that I'm doing. And I think when all is said and done, that I will have accomplished a lot, and I've made society better, I've made my community better because of the work, and also help nurses and help increase the likelihood that our bedside nurses will go into things like politics and will make even a deeper impact than nurses already make. And I hope that we can have as many nurses in the legislature as we have lawyers.
Well, thank you for sitting down with me today, Representative Kahn. I really appreciate it. Thank you for letting us all know what you're up to now that you're in a completely different place, and not just helping nurses, but people all across Pennsylvania. So again, we thank you for that, and thank you for sitting down with me today.
Appreciate it. Thank you.